Welcome to the Starfish Storytellers, the podcast that makes a difference one story at a time by bringing storytelling to life.
I was at a seminar with 50 physical therapists, and the instructor made the following statement: diagnoses have seen you, but you have not seen them. Now, what did he mean by that? There was a study done by McKenzie physical therapists who are trained and certified in that method of 36 consecutive patients who came from specialists, and the diagnosis that was given by the specialist turned out to be incorrect 71% of the time. So an example would be a patient would come in with an elbow pain, let's say from playing pickleball, and the doctor's diagnosis is elbow pain. A McKenzie therapist will evaluate them, and they will start up at the neck and clear the neck, make sure the neck is not connected to the problem. And they don't have to have neck pain. And many times, and I had a case exactly like this, where the patient came in with pickleball elbow, and it turned out that the treatment that got the patient better was neck treatment, no elbow treatment whatsoever. Now, one of the most dramatic cases that I've ever seen came from a referral from the Cleveland Clinic from the director of the Headache and Balance Clinic. And this patient happened to be from the same city that I was working in. And I've been working with this doctor at the Cleveland Clinic for over 14 years. He referred the patient to me, and the patient told me that she had been having symptoms such as almost passing out, headaches, dizziness, imbalance, difficulty walking. Like when she go shopping, she would be going off to the side and things like that. The immediate thought by most doctors would be there's a possibility of a brain tumor here. And so they did a brain MRI, but nothing showed in terms of any negative consequences. So she was then referred to a ear, nose, and throat doctor, and they did inner ear testing. And the inner ear testing was all negative. So the doctor who did that meets with the patient, and the patient said, well, what's going on? What is my diagnosis? He said, well, your tests are all normal. So I guess your diagnosis is GOK. She said, what does GOK mean? He said, God only knows. And the patient was like, what does that mean? Well, she ended up going to the Cleveland Clinic, and she was referred to me here. We did our neck evaluation, and sure enough, all the symptoms were coming from her neck. We did the appropriate neck exercise program, and after a bit, the symptoms resolved. A McKenzie evaluation was the key to this patient's success.
Hello, my name is Liana Henry, and welcome to the Starfish Storytellers. I'm the CEO of the Black Dog Group and your host. I'm passionate about storytelling and on a mission to raise up the next generation of storytellers. We're called the Starfish Storytellers after the moral of the Starfish story, which centers on the power of one. Because no matter how big the challenge, every action matters. One step, one starfish, and one story at a time. Every episode will welcome a new storyteller who will inspire and connect with you. So thanks for tuning in. Now let's get started. Today's episode is Rewriting Pain, the Mind, the Body, and the Power of Story. And with me today is Ron Clinton. Ron is a physical therapist, an educator, and author with over 35 years of experience helping patients overcome back, neck, and knee pain. He's a certified McKenzie Method practitioner and has been recognized for his work in patient education, earning him Patient Educator of the Year during his time leading back care programs at major hospitals. Throughout his career, Ron has worked with thousands of patients, including some of the most complex cases referred by surgeons and specialists, and has built a reputation for helping people find relief through conservative, evidence-based approaches that often avoid injections, medications, and surgery. We're going to talk a little bit about that today. Ron's work is rooted in the belief that healing doesn't just come from treatment. It comes from understanding. Through his book, Self-Managed Knee Pain, and his workshops on stress and well-being, he empowers people to take an active role in their recovery and rethink what's possible for their bodies and their lives. Ron works in a space where the stories people carry about pain, what it means, what caused it, and what comes next can shape everything about their recovery. And through his work, he helps patients challenge those narratives, rebuild their confidence, and move toward a better quality of life. So welcome to the Starfish Storytellers, Ron. We're really happy you're here.
Well, thank you. It's really an honor to be part of your program.
Thank you. So, Ron, we kick off every episode by asking our guests to introduce themselves. So would you mind telling us a little bit more about you in your own words?
Sure. I think I'd like to start by telling you how I got into physical therapy in the first place. And it is really a serendipitous type of situation. So I really had no thought or idea of what I wanted to do as a career as a Macomb Community College student. And so I had read some books by a Dr. Thomas Dooley, who was a Navy surgeon who was stationed in Southeast Asia during, right around the time the Vietnam War started. And he served a tour of duty there, serving the people in little communities there. And after he was done with his tour of duty, he fell in love with these people there, and he just decided to stay and establish clinics throughout Southeast Asia. And he'd come back home and he'd do lecturing and raise money. And so he's doing this really good work. So I had this inkling of medicine. And I was going to enlist in the Army as a medic. I thought maybe I might find out something about medicine doing that. And I got to the recruiter's office early that day, and he said, well, I'm talking to somebody now. Why don't you go over in this room? There's some literature, you can look at it. So I go in there and I open up this book. It's called Careers in the Service. And I'm flipping the pages. Physical therapy. Oh my God. I loved sports. I played hockey, baseball, football, basketball, everything. And then medicine. I said, this is the perfect combination for me, medicine and exercise. And I was going to tell the guy that instead of signing up to be a medic, I wanted to be a physical therapist. And he says, okay, well, let's see what you have to do. And so we started doing the paperwork. And he said, oh, wait a minute. There's a problem. I said, what's the problem? He says, they're only taking women. At that time, they only took women in physical therapy. So I said, but is there someplace else I could learn that profession? And they said, well, let's see. We looked it up. He said, well, Wayne State University in Detroit. I said, okay, well, I think I'm going to just wait a while about enlisting here. So I went and researched all of that, found out what I had to do to get into physical therapy school. And I managed to get in and graduate and start my career. Now, who I am in terms of being a physical therapist and a person, I'm someone who loves to exercise, and I love to share information, and I love to facilitate healing. And I try to be a good listener by listening with both the ears and the eyes, of taking in the whole story, not just the words, but the body language and that type of thing as I'm working with a patient. And I try not to present myself as the healer, but as the facilitator of healing, because it's a partnership between the therapist and the patient in terms of things that I can do for them, but things that they have to do themselves. We can point them in the right direction, but they have to follow through in order to get the best results.
Well, thank you for sharing that. I was listening to the story that you were sharing about that patient, and how often does it happen, right? That doctors just respond to the pain that the patient reports. And I'm a huge proponent for root cause. My whole family, actually, we've all worked with trainers for different types of strength competitions, strongman, powerlifting, things like that. And I had a really bad episode bout for like 6 or 8 weeks of sciatica. And, one of the things that, and I know how I did it. And one of the things that my trainer had said was, he talked about what you were talking about, like looking at all the places around that impacted spot to see where else there could be an issue. Because I think so often we focus on that one spot where the pain is, but we don't think about, where the hip is. You're not thinking about the knee or the quad or or the glute or the back. But I don't think people even think to do that. It's so interesting because in the story that you told, and even in your introduction, storytelling doesn't always happen through words by themselves. It's how we understand our bodies, right? And people carry stories about pain. They carry stories about how is it caused, and what it means, and what's going to be possible. And of course, when we're in pain, we want to feel better quick. And that can limit them, I think, having that, walking around with that story, and it can limit their ability to heal. And we do live in a world right now where quick fixes, invasive solutions, those are usually the loudest voices. And it seems like you do the work that reminds people that understanding, patience, the right guidance, and you just said it when your introduction, it's the team sport between physical therapist and patient, that can change their narrative completely. And so really, I guess it's not just about treating pain, right? It's helping people feel empowered and capable and in control again. So it really does, I would think, change that mindset, that story from limitation to possibility.
Right. And I think a lot of times when people come to me who've been to several doctors, a lot of the patients I've received from the Cleveland Clinic who live in the Michigan area here, they've been to 2, 3, 4 neurologists before they see this doctor at the Cleveland Clinic who has an interest in the McKenzie Method. And Cleveland Clinic is very big on the McKenzie Method. And so he looks at them differently than other doctors do. In other words, he looks at the big picture and from the top down, as opposed to just the symptoms. Even when they come to me from him and he's giving them some potential, for a different kind of approach, they're kind of hesitant, they're leery, but we take plenty of time, and I really try to listen to their complete story because it's a unique one. There's no two patients who are alike. There's no two programs for PT that are alike, even if they have the same diagnosis, because of so many factors that come into play. So it's a time commitment, but it's worth it if you can get to the bottom of their problem. And they're really grateful if that does happen, because it can literally change their life.
Mm-hmm. Mm-hmm.
Yeah.
You just said it. You said they're grateful. You just said it. I mean, you're helping people understand what's happening in their bodies. And I'm guessing, based on what you just said with the person that had four neurologists, by the time they got to you, they're probably frustrated, they're stuck, they're scared. Do you ever use storytelling examples or analogies, or, obviously not using names, but just to help the patients shift from something's wrong with me to maybe this is something that can improve?
Right. I do it all the time in terms of especially weaving in research that has been done that shows there's potential for you to get better. For example, I've had patients in their 80s who have a lot of arthritis. And, they say, well, how can I get any benefit? I'm so old. They just think aging, that's the problem. But it's not just aging. There was a study done with 90-plus-year-old patients. Okay. They're in an assisted living place. And I can't remember the exact numbers, but I'm going to use 100 because it's easy to explain it. Okay. So they take 100 people over 90. And so I sit down with the patient and explain this. And they test the strength in their legs. On a various machine that can analyze that very carefully. And they take half of them and they put them on a strengthening program right there in their facility 3 times a week. And the other people, they just have them go back to what they were doing. They say, we're going to have you back in 8 weeks. I'm going to retest you. And so in 8 weeks, they retest. People who did the exercise increased their strength by over 100%. The other people, of course, didn't. Nothing really changed. So then the next part of the experiment was to take the 50 remaining, take half of those and say, okay, you can go back to what you're doing now. The other 50 continue for another 8 weeks. Bring them all back, test them. The ones who continue to exercise, they're still doing great. These guys are starting to lose it already. Okay. That sometimes will be a real eye-opener for patients. And they say, well, I'm only 83 or something. I guess I can get stronger, And a lot of times these people who have balance issues, it's not anything in the inner ear. They're losing strength in their legs over time. Research shows that the older we get, the more our strength goes down. And the older we get, the more our muscle mass goes down. You combine those two things, and then what used to be easy walking or walking on an uneven surface or something now is very difficult, and you're worried about your balance. So I often use stories like that, and I weave in research so that motivates them. It gives them hope, and there's an understanding, and then there's a motivation to act on the understanding, which leads to results,
Right.
So it's translating the research into the understanding of the patient so that they can use that knowledge to get better, get stronger, to get control of their symptoms, that type of thing.
And I would imagine too, it would be a real credibility piece for you when you're able to tell story after story of patients who followed the plan, followed their physical therapy plan, their exercise plan, the strengthening plan for those areas of their body that were the problem. I'm sure it really reassures someone to say, okay, he's telling a story and it resonates with me. He understands me. He understands my problem. He's got experience. He's done this before.
Right.
And, that gives somebody an opportunity to be able to change their narrative. Okay, I'm willing to try this. I'm willing. Right. There is possibility here.
Yeah. So one of the biggest problems in medicine in general is that patients are only adherent to the instructions given about 1/3 of the time. It's a really bad statistic. But I learned that many years ago, and then I've heard recently it's still about the same. And so I've been committed since learning that my patients are going to be better than 1/3, that I am going to help them understand the importance of their home program, and that the home program is even more important than in the clinic, because we can only be in the clinic 2 or 3 days a week, but you are going to do this program 7 days a week, you know? And so most of my patients are pretty adherent to their instructions to get the best benefit. And it starts with understanding, and however you can get that. And I think stories about former patients or research often motivates them strongly. They feel if they did it, I think I can do it.
Do you feel like, I mean, I know for me, I do better when I have a coach or I have my physical therapist. You know, I have that accountability person and the person who's skilled and knows how to help me. And when I do what they're suggesting, I feel better. Do you have many long-term patients, or is your treatment model or plans usually sort of a little more short-term? How does that usually work? Or is it just dependent on whatever the condition is?
Yeah. Usually I don't see anybody for more than 2 months. That's more exception than the rule. Most of them are about a month. But I always leave the door open. I say, call me if there's an issue and we'll deal with it. Or if there's another area of the body that is concerning you. Yeah, sometimes I'll see a patient and we'll, for example, today, patient, I'm seeing him for his neck, and it's getting better, doing well. But then he said, well, I saw him for his back, I don't know, 6 years ago, something like that. And he said, my back's been acting up lately. I said, okay, well, he's got an appointment set up with his back doctor. And I said, I know him. I know that doctor really well. Next time we'll do a little quick eval on your back and I'll send him a note. The goal is not to keep the patient for a longer time. It's for them to become independent of practitioners so that they think like a PT does in terms of their body mechanics, and try to get them to stay on a program. Like I had one lady recently, 95 years old. I saw her 6 years ago. She's got a problem going on right now. And she says, I'm still doing those exercises you showed me 6 years ago. And she's sharp as a tack. She does them like twice a day. So that's what I hope to have for each patient, that they stick with their program over time, that they're motivated enough to continue on with their program and maintain independence. She lives by herself, and I'm sure that has contributed to her doing those exercises on a daily basis.
I always say the key to independence is mobility. And one of the other things I think I read about you is that you emphasize that movement is medicine, and that really what happens both physically and mentally when somebody shifts their story from I need to rest and protect this to I need to move so that I can engage my body again.
Yeah. So with this idea of, moving, there's been so many studies done, really a bunch recently, where they compared groups of people who were sedentary to active, more active, over long periods of time. And always what comes out of it is the people who were more sedentary have more health issues, don't live as long, and sometimes, mentally, they tend to go down cognitively as well. So moving increases blood flow to the brain, which helps, they say, for dementia type things, prevention, do things to stimulate the brain, but also get more circulation to the brain. So many older patients, they want to stay in their home. And I had a patient one time who had a back problem in a big old house, all the kids are gone, but she wanted to stay in that house. She loved the house. And we would do the back exercise with her, and she'd feel good, and she'd go home, and she'd come back next time and got the pain again. And I said, "Well, did you do your exercise?" And she said, "Yeah, I didn't have time or something." And this kept happening a couple of times. And I had to go to the story of, you're not moving enough. You're going to be losing your strength, and you're not going to be able to stay in that house after a little while. You're not going to be able to take care of it. And you're going to have to go someplace else. Well, she started doing the exercise, and she started moving.
Mm-hmm.
And so she couldn't see down the road the consequence, but I could. And I was able to explain that to her and turned it around for her to get with the program and stay independent.
Yeah.
Mm-hmm.
Yeah. It really is so important. So I want to talk a little bit about restless leg syndrome. I was introduced to restless leg syndrome by someone that I was helping. And she talked a lot about how it would happen in the middle of the night, how nothing she did ever helped. Her doctor would just put her on trazodone to get her to sleep at night. We started talking about this, and you would let me know that you've been looking at this condition, or RLS, I think it's also called. And I know it can be very painful, very disruptive, very uncomfortable. So, for somebody who's dealing with this, especially when it's affecting their sleep, when it's leading to exhaustion, do you ever hear from them? Like, what's the story they're telling themselves as to why this is happening? And what are the things that you're saying to them? What stories are you using to help them get some understanding so that they can shift their minds? Because, sometimes I really do believe healing can be mind over matter. What are you saying that can help them get to that understanding so they can shift into taking actions that are going to make it more manageable, maybe even more hopeful?
Okay. So first of all, restless leg is kind of a complicated condition. A lot of patients have some type of issue with iron in the body that needs to be addressed by a physician. And if that is the case and they identify a solution for that through supplementation, or in some cases they do IV intervention. So that is a case where it's a medical solution to the problem. Let's say that takes care of it. But a lot of people, they have it and they're not sure, the doctors even, they're not sure why they have it necessarily. And they have this pattern of typically in the evening and sleeping that they get these symptoms. But in general, for people with restless leg, movement is beneficial. Trying to move more, especially in the evening. Because what's the pattern of a lot of people? They're busy during the day, and then they sit down after dinner for long periods, which could contribute to leg issues. Because the longer you sit, the more pressure builds up in your low back. So there are a lot of patients who have no back pain, but they have a back problem that is in the legs. To give you an example of a patient I had, she was 64 and she reported that she had restless leg for 15 to 20 years. And she even mentioned that when she was a teenager, if they go on a long trip, vacation, she'd be sitting in the car and she said her legs would feel weird. So anyway, she would be fine during the day. She was a teacher's aide and she worked for a few hours in the morning every day, no symptoms. During the afternoon, no symptoms. She'd be busy with house things. But then sometimes a little later in the evening, after sitting watching TV for a while, she'd start to maybe get some. And then she was frequently waking up at night with the symptoms. So she had gone to doctors, and the typical solution, if it's not iron deficiency issues, is they put them on some kind of medication. And the medication usually makes them drowsy, okay? And it takes a little while to kick in. And so it's not a great solution for people. And for the general people with RLS, moving more in the evening may help. Just doing that, getting up every 20, 30 minutes, moving around for a couple minutes, that may help them. For a person with a back issue, further back exercise may really help them. So we started working with her, and I saw her for a total of 13 visits, and I think 2 times a week for about 6 weeks. Little by little, she started getting control of the symptoms and was having less and less episodes at night. And then she was able to start cutting down on her medication. By the end of it, she had minimal nighttime symptoms, just occasional. But she could always get rid of it by doing the exercise. And she had really significantly reduced her medication. What I've been doing here, working with another therapist who's got the McKenzie training as well, is we're trying to identify these patients. It's hard to know how to find them. So we put up a sign in the lobby, just started doing this. And I did a presentation last Monday at a senior center nearby, had 18 people come. So there was some interest there. And we'll see how it goes. We're trying to identify these folks and see if they might respond to back exercises. And that could really radically change things because they could get off the meds and control the symptoms with back exercises, which would be ideal. Yeah, so that's where we're at.
Oh, interesting. And it's just such a reminder that we just don't realize how everything is interconnected. You know, it's like your legs and your back and your shoulders and your back, and, you know, everything is interconnected.
And one thing I want to say is that if you interviewed other McKenzie trained therapists who've been practicing for a few years, they would have very similar stories about patients. It's nothing special about me. I've had this great training that I've been able to use, and I'm just thankful for it every day that I've had this training because it puts me in a better position to help people.
Mm-hmm.
You know, I would like to say that if anybody's dealing with those kind of musculoskeletal issues out there, they can go to the McKenzie website, which is McKenzieInstituteusa.org. And you can find a practitioner wherever you live, pretty much. You just put in your state and your zip code and the radius, 10, 25, 50 miles. And you should be able to find practitioners that you could go to and get an evaluation, and they may be able to help you deal with the issue you're dealing with.
So, yeah, clearly one solution is to go to the McKenzie site. But in your mind, you know, with your experience, what is a belief that they really should challenge? You know, how can they start changing their relationship with pain and moving towards that better quality of life?
Yeah, so it's a mindset that you can't ever give up. You have to keep searching for answers. And that's hard when you've had a series of failures, so to speak, or not good experiences. But I would encourage people to keep searching. And I feel, again, the McKenzie site for these kind of problems, if you haven't had a McKenzie eval, I don't think you've had a complete eval of your condition. It's worth doing that and knowing you've covered all the bases, in my opinion.
Yeah.
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 Mhm.
Such good stuff. Well, I could keep talking about this, but Ron, that's all the time we have for today. Thank you so much for joining us and reminding us, storytelling doesn't always have to happen on a page or a stage. Sometimes it just happens in the way we understand our bodies, right? And maybe challenge what we've been told. And it's just a really great way to take back control of our healing, maybe one movement at a time.
Right. Absolutely.
And to our listeners, whether you've first heard us locally through BTV studios in Bedford, Massachusetts, or you're tuning in from across the globe on Spotify, Apple Podcasts, or Amazon Podcasts, thank you for listening. We hope you enjoyed this episode, and we'll see you next time. Happy storytelling!